In any healthcare practice, your team is your absolute greatest asset, right? They're the ones providing care, managing operations, and building that crucial patient trust. But what if I told you they could also be your single greatest liability? Today, we're unpacking a critical legal concept that every single doctor, clinic owner, and hospital administrator really needs to master: vicarious liability.
Just think about this for a second. Your receptionist, an administrative staff member, makes a really serious mistake. Say, a breach of patient confidentiality. Now, you didn't do it. You certainly didn't authorize it. You might have even trained them specifically not to do it. So, are you on the hook? Well, the answer, more often than you might think, is a firm yes. And understanding why is absolutely essential for navigating the risks of modern healthcare.
So, what exactly is this legal doctrine? At its core, vicarious liability means that you, as an employer, can be held legally responsible for the wrongful acts of an employee. And it all hinges on that special relationship, the employer-employee relationship itself. It's not about your fault, it's about your responsibility.
All right, so here's our roadmap for this explainer. First, we'll dive into why this is so critical in a healthcare setting. Then, we'll break down the core legal principles and tackle that really crucial distinction between employees and independent contractors. After that, we'll look at some common, real-world triggers, and we'll wrap up with an actionable plan to help you mitigate your risk.
So let's kick things off with why this whole concept is particularly explosive in a clinical environment. Honestly, it's because healthcare is built on teamwork, on delegation, and on a huge degree of patient trust, which, when you think about it, creates the perfect storm for vicarious liability.
And the stakes are incredibly high. A hospital owner can be held legally responsible for a mistake made by a junior nurse. A solo practitioner can be found liable for the actions of their dental assistant. And let's not forget the patients. They often sue the institution, not just the individual. Why? Because they see the institution as having the deeper pockets and the ultimate responsibility. And this isn't just about clinical errors. It could be anything from staff misconduct to a simple privacy breach.
Okay, let's get into the legal mechanics of how this all works. Because understanding the foundation is really the key to building a solid defense.
Now, the legal term master-servant might sound a little archaic, but the principle behind it is very modern and very clear. It all comes down to control. If you, the employer, control the actions of another person, their actions during their employment are, for legal purposes, seen as an extension of your own.
This right here is such a critical distinction. You have direct liability, which is when the institution itself is negligent, by hiring unqualified staff or having unsafe systems. That's pretty straightforward. But vicarious liability, that's the tricky one. This is where your systems, your training, everything could be perfect, but you are still liable. Why? Because your employee, acting within the scope of their job, did something wrong. The liability literally gets passed up the chain of command.
And that brings us to what is probably the single most debated area in all of healthcare liability. Who exactly is considered your employee in the eyes of the law?
The scope here is incredibly broad. We're not just talking about your clinical team. It's the lab technicians, the hygienists, the administrative staff at the front desk, even housekeeping. Basically, anyone working under your direction who is part of the overall patient experience could potentially expose you to liability.
And here is the absolute key point. You can't just slap the label independent contractor on a contract and think you're in the clear. The courts will look past the title of that document and investigate the actual day-to-day reality of that working relationship.
So how do they do that? Well, they apply several tests. There's the control test, which asks who sets the hours, the fees, the protocols. Then you've got the integration test, which looks at whether this person is presented to the public as part of your team. And finally, the economic reality test asks if your business is fundamentally dependent on their work. If the answers to these point towards yes, they'll almost certainly be considered an employee for liability purposes, no matter what the contract says.
Let's make this real with an example from India. Hospitals there are often held liable for what they call attached consultants. The reason is fascinating. It's all about patient perception. If the hospital handles the billing, provides the room, and the patient didn't independently select that specific doctor, then in the patient's mind, that doctor is part of the hospital. And in court, that perception often becomes legal reality.
So we've covered the theory. Now let's get practical. How does this actually play out in the daily life of a busy clinic or hospital? What are the common tripwires you need to look out for?
The most obvious triggers are, of course, clinical. A nurse gives the wrong medication or doesn't report a critical change in a patient's condition.
The immediate error belongs to the nurse, but the legal responsibility? That very often lands right on the institution that employs them.
And it goes beyond direct patient care. Think about your technical staff. A mislabeled lab sample, an incorrect radiology report, these things can lead to catastrophic outcomes. The technician might have made the mistake, but the hospital is held liable for that failure in its diagnostic process.
And it's not just the clinical side either. Administrative failures are a huge, often overlooked source of liability. Something like poor record keeping or a receptionist giving out incorrect pre-op instructions can directly harm a patient, and you can bet the clinic will be held responsible.
Finally, remember that liability extends beyond competence to simple conduct. A staff member who breaches patient confidentiality, is verbally abusive, or, in a worst-case scenario, assaults a patient, all of these can create massive legal exposure for the employer who put them in that position of trust in the first place.
Okay, knowing all of these risks is one thing, but what can you actually do about it? Let's turn to a concrete, actionable playbook you can use to protect your practice.
Your best defense is always a multi-layered system. It all starts with crystal clear contracts that define everyone's roles and limitations. Then it demands relentless, regular training on everything from clinical protocols to patient communication. You have to implement and actually enforce standard operating procedures, SOPs, to minimize human error. Crucially, you need clear policies on supervision so no one works outside their competence. And last but not least, robust indemnity insurance is your non-negotiable safety net.
So, let's just quickly recap the absolute key takeaways here. Number 1, vicarious liability is a serious threat that holds you responsible for your team. 2, that independent contractor label is not some magic shield. The reality of the relationship is what truly matters. 3, liability can pop up everywhere, from clinical mistakes to administrative slip-ups and bad behavior. And finally, your only effective defense is a proactive, systematic approach to managing that risk.
I'll leave you with this final thought to consider. You can have the best contracts in the world, the most detailed procedure manuals ever written, but liability is often decided by what happens on the floor, in the moment. So ask yourself this: are your policies just sitting on a shelf, or are they being lived out every single day through active, adequate supervision? Because the answer to that question could be the difference between a thriving practice and a devastating lawsuit.